The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You were watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, mommy makeovers. With us, we have a board-certified plastic surgeon. He is Arizona's plastic surgeon. He is Dr. Cohen. Dr. Cohen, welcome to the program.
Hi, thanks for having me here, Andy.
All right. Now, before we get into today's topic, for people that don't know you, tell us a little bit about your practice. Before we get into mommy makeovers, who's your typical patient? What are the procedures you do?
Okay, well, as you mentioned before, I'm a board-certified plastic surgeon. I do a wide array of elective surgery procedures, and I would say my typical patients tend to be women in their 20s to 40s, but I see a lot of other women who are older than that too. I also see some men in my practice as well, and I do basically everything.
Like what?
Well, the majority of my practice tends to focus around breast and body surgery, so I do a lot of breast surgery, including breast augmentation, reduction, breast lift surgery. I do tummy tucks, liposuction, and I do all the other facial procedures like eyelid surgery, nasal surgery, facelift surgery. Pretty much you name it, I do it, but like I said before, focus of my practice tends to be breast and body.
So what's the hottest procedure right now?
Well, one of the hottest procedures that I'm being asked about all the time is mommy makeover surgery, which is basically...
Do they call it that? I mean, the patients come in and say that?
Yeah, it's not a technical term, but it's become sort of commonly known in the public as a mommy makeover, and it's basically for women who have had major changes from pregnancies and want to get their old bodies back. They want to look beautiful again. They want to feel comfortable in bathing suits and feel comfortable with their significant others, and they're coming in for help for things that they can't fix on their own.
Now in Arizona, I mean, where you are,
right?
And where are you in Arizona?
I'm in the Scottsdale, Paradise Valley area, but
you grew up there, right? Is that right? You went to high school there?
Yeah. I went to Phoenix Country Day School, and then after graduating from there, I basically did a long tour around the country for about almost 15 years for my education.
You went to Ivy League colleges. Let's talk a little bit about your background and training.
Yeah, well, after Phoenix Country Day School, I went to Emory University, which is in Atlanta, Georgia, and it's a top 20 school, and basically very well known for its medical focus, for pre-medical students. So I started there, and after that I went to Tulane University, which is where I did my medical school training, and that's in New Orleans. And Tulane's particularly known for hands-on surgical training for their medical students. So I knew I wanted to be a surgeon, and that's why I went there. I wanted to get
then Dartmouth. You went to
training.
Dartmouth.
Yeah. So I went to Dartmouth for my residency program training. So that's where I did my general surgery, plastic surgery. I worked with some of the best plastic surgeons who are doing breast surgery in the country, and basically got excellent, well-rounded training both in cosmetic and in reconstructive surgery.
When did you know that you were going to be a plastic surgeon?
Actually, people always ask that, and oddly enough, I knew when I was in high school, probably when I was about 16 years old.
Really?
Yeah, it was kind of unusual, but I'd seen some shows on TV about plastic surgery. I became really interested. I was always very into art and drawing and doing things with my hands, and I also like the science aspect of
so you
surgery.
actually knew you wanted to be a plastic surgeon. You were in high school.
If somebody saw me in high school and they asked me what I was going to do in the future, I would tell them I wanted to be a plastic surgeon. It was kind of weird back then because plastic surgery wasn't as, public as it is now. It isn't on TV all the time back at that point. So I just knew I had a real interest in doing it. And if you'd ask me now, it's pretty hard to know what you want to do at that young age. But I stuck through it, and I basically kept going. Each level of my education, I knew what my focus was.
Now I know your age, and you look about 10 years younger than your age, and you've done what? You've done thousands.
Yeah, I've done thousands
of surgeries. You've done a lot of procedures.
Yeah, I've done probably well over 1,000 procedures or more before I even finished my residency program.
One of the things you told me on the phone, which I thought was good, you said, Randy, go to my website. And it was interesting the way you said it, because you were kind of bragging about yourself. I said, brag about yourself a little bit. Tell me something about you, right? I said, we're not going to say it on my show. But you said, look at the before and afters on my website. You said, I would challenge you to find better photos anywhere else.
Right. Well,
And it was true. And I looked.
Yeah.
It was good work. Obviously, you're putting your best work on there, but it's still better than other people's best work.
When you're looking at the website, I always tell patients, if you're looking before and after, if somebody has one before and after or three or whatever, they're putting up their best work, and that's not really how it should be. You should put up a wide array of your work so people have a good, realistic expectation of what you can accomplish. So I have hundreds of patient photos before and after up there, and I wouldn't say they're all my absolute best. I'd say it's a range. Some of them I would consider, some of my best cases ever. Some of them are very average cases.
You said that you go to conferences with other plastic surgeons, and they compliment you.
Yeah,
is that right?
It's always a huge compliment for me when I meet one of the experts in the field and they've seen my website and they actually say, you have really nice before and after photos, or they're talking to me, and for me that's nothing makes me prouder than having one of the best in the business come over and say, hey, I really like your work, and because that's a real, for me, it's a real confirmation that I'm doing what I'm trying to do.
Let's begin with mommy makeover then.
Yeah.
Okay, today's topic. What defines a mommy makeover?
Mommy makeover is basically just a general term. There's not like a specific mommy makeover, but it usually entails surgery to make somebody who's had body changes look the way they did before they started having the kids, feel good about themselves again, look young, look healthy, and how they wish they had looked after the kids. So basically, it generally will include some kind of surgery for the breast, whether it's a lift or reduction or augmentation, some kind of surgery for the torso, usually meaning some type of tummy tuck surgery, although it could be a full tummy tuck or a mini tummy tuck, and then generally some liposuction as well, usually in the love handle areas or maybe the inner and outer thighs. But the bottom line is there's not one mommy makeover. It's basically a customized procedure that I do for a patient who comes in wanting to look and feel better about themselves. So I take a look at them in the office, I evaluate them, and I tell them, what I think would work best for them based on what they're searching for.
And what are the age ranges of these mommy makeovers?
It's a really good question because people think, okay, a mom, 30s, maybe 40s. I see a whole range of patients. Some patients are in their 20s who maybe have had multiple kids and they say, hey, I'm done. I can't go on the beach anymore in my bikini. I want to look good for my husband, and they're ready for a mommy makeover. I see some patients who are in their 50s or 60s who probably wish they had done it many years ago because they've been hiding. Yeah, well, they haven't been to the beach. I've had patients who literally told me that they haven't let their husbands see them in the nude or with the lights on in the bedroom for over 10 years, and it always makes me a little sad because that's so much time that they've wasted where they could have been feeling good about themselves.
Do you hear the follow-up stories?
I do.
Where they come in and say, oh my goodness.
Yeah. That's the best part, is when they come back and they're looking, they have this kind of glow about them and a huge smile. They usually come and give me a big hug and say, wow, I can't believe how good I feel or how good I look. And sometimes the husbands will be there and they'll be kind of smiling and nodding on the side. So yeah, that's probably the best thing about doing what I do, is being able to really make a big impact in people's lives, make them happy, make them feel good about how they look.
On these consults, do they bring their partner?
Sometimes I do.
Do you encourage it?
I do encourage it. I think it's a great idea to have family involvement, and very often I'll see patients with their significant others or husbands. Sometimes the husbands are a little bit reluctant about things because,
why is that?
Well, sometimes they'll say, oh, I'm worried about scarring, or I'm worried about my wife looking different than she did before, or they'll say, hey, honey, I love you the way you are. I don't want you to change. That's always great to hear. But the women who come in, they want to look better and they want to feel better, and it's not a matter of being good enough. They want to look their best and they want to feel like and look like how they did before the kids.
When they come in for a mom and makeover, what do they confide in you? What are their goals? What do they say?
I mean, some of them, it's a wide range of emotions. Some of them come in with a sense of humor, and they'll say, I'm tired of rolling my breast up and stuffing them in my bra, and they kind of laugh about it. I have some patients who come in who can't even make eye contact because they're just so self-conscious, and that always,
right?
Yeah, it's always a little, it's upsetting for me when I see patients affected that much by their physiques. And with both those patients, they're going to see a huge improvement in how they look and feel. Probably the most dramatic changes I see are the ones who, like I said, have difficulty making eye contact, very self-conscious. Sometimes those patients come in, a few months later after their surgery, and it's like a different person's walked in my door. They're dressing differently. They have a different look about them, and they're like usually beaming and with big smiles, and they just can't believe how happy they are.
Now you say you're changing people's lives, and by the way, the photos, and Dr. Cohen brought some photos. Probably the most dramatic. Our program airs throughout the United States.
Right.
I've had surgeons over the years, and these are, and I'm trying not to endorse you.
Okay,
I mean, people need to know this is a real interview.
No, absolutely.
But these are some of the best photos I think I've ever seen. Maybe the best photos for my makeover.
I appreciate it.
But you say you're changing people's lives.
Yeah, I mean, I always
elaborate on that.
Well, I always tell people the type of surgery I'm doing is not life-saving surgery. I'm not taking cancers out. I'm not, I used to do that when I was doing my reconstructive surgery, but I'm doing life-changing surgery where somebody really can be one type of person before surgery, and then they become somebody else in a much better way after surgery. It's just a self-esteem booster, a self-confidence increase, just feeling and looking good. And I always tell patients, that a lot of my prior patients, the biggest change they have as a result of surgery is a lifestyle change, where all of a sudden they're looking good, they're feeling good. Now they have motivation to go exercise.
Oh, good point.
They're
okay,
dieting.
So they're more active now.
Absolutely, they're doing things that they weren't comfortable doing before the surgery. And I get patients to quit smoking cigarettes for the surgery. So there's a lot of side benefits from a health standpoint that come with feeling good about yourself.
We're going to take a break, but let's take a look at some of the photos.
Okay.
What do you have for us?
All right, well, I've got some excellent photos I'd like to show you today. And this is one patient in particular, a 30-year-old woman.
All right.
Take a look over there. And as you can see over here, you know,
What's going on there? I mean, is that common?
Yeah.
You see that a lot?
I mean, you probably don't see patients like that walking around the town or at the beach because they're frankly embarrassed. They're going to cover up their stomachs. They're not going to wear two pieces. They're probably wearing Spanx or some kind of compression garments under their clothes to look decent.
Is that an older woman?
That was one of the reasons she came in, is she felt she looked a lot older body-wise than she was. She was exercising. She was.
So she's how old?
She's in her 30s.
Okay.
And you know, based on how she looks in this preoperative photo, you wouldn't know. But I mean, you've got this really ripply, loose skin around.
So certain women just don't bounce back.
That's exactly right. There's a lot of genetics involved. So sometimes people can have a couple kids and they look great, and some people have one child and you know,
and this
all hell breaks loose. What's that?
Okay. And this happens.
Yeah. And
so what do you do for that? I mean, when you look at that, what do you do?
Well, I'm looking at this abdominal area, and we're seeing a lot of loose skin. So I know all that excess skin has to be removed, and the rest is stretched and tightened down to give her a smoother look. But deeper to that, the muscles are also bulging and out of position. I need to tighten up the muscle wall to give her sort of that potential for a six-pack again.
Tighten the abs?
Yeah.
In a tummy tuck?
Correct. So I'm not actually cutting or doing anything directly to the muscle, but I'm doing internal stitching to bring them, or to the connective tissue that surrounds the muscles, to bring those muscles back to the midline again, because they've been stretched out with the pregnancy, and now we're trying to bring them back. Yeah. So it's I always tell patients it's a two-layer repair. The deep layer is the muscle connective tissue layer, and that kind of resizes and reframes your core, gives you a nice curve to your waistline again. And then the second layer is the loose skin and fat overlying that. So it's almost like you're creating the new framework, and now we're tailoring the skin and fat to fit that framework, and
that'll flatten out the abdomen.
Yeah, so the abdomen will be flattened out. It'll give you a nice waistline again. It'll give you a smoothness to the skin again. And I'm doing all this by keeping the scars very low.
You like the scars low? You say.
I do. So do patients. They like to have a nice low scar line. I've seen some patients who have come in who had tummy tucks, you know, way in the past, and they'll have these scars that jut up sort of in a French bikini cut pattern or something weird. Or some patients will come in complaining of a sort of a regular
technique?
scar.
Older techniques?
You know, I think some of it's based on technique. Certainly there's variability patient to patient, but in general the goal should always be to keep the main scar as low as possible so that patients can wear a, you know, lower cut jeans or a bikini that'll cover the whole scar. So, you know, as you can see in the photos on the website, you don't see the tummy tuck incision because the scars is kept below.
So let's take a look at her after. What's going on with her? Okay.
So, well, you know, as you can see here, I mean, it's a
very
huge
nice
improvement. And now all of a sudden we've gone from this older, loose, sort of unfit looking abdomen. Now she looks like she's in incredible shape. Because I've revealed the frame that she had underneath, tightened up the muscles, and taken out that extra skin. So I've done all these things that she couldn't, and now all that exercise she'd been doing before surgery, and certainly the exercise she's going to be doing after, will be visible to everybody else who's looking at her. So as you can see, I mean, she really looks tremendously better than the before photos, but I think one of the takeaway points in this particular patient's case is that she told me she looked better after surgery than she ever looked before surgery. So, you know, in some of these cases, we're not just making them look the way they did before surgery. Some of these patients look better than they did even before the kids.
Now, what about just liposuction on a small area like that?
Look at the before and after again. You cannot get that level of smoothness of the skin and tightness with liposuction alone.
So on that after, that is
possible. Yeah. You have to remove skin to get those kind of results, and you have to know which type of tummy tuck and be able to apply it correctly.
Okay, good. Now we're going to take a quick break. We come back. You brought more photos, and by the way, we saved the most dramatic photos for last. I mean, some of these are really, are they doctored up a little bit?
No, absolutely not. That's totally unethical. So all the photos are as is.
You're watching The Wellness Hour. I'm Randy Alvarez. We're going to take a quick break. When we're back, more about the process of the mommy makeover, the evaluation, what to expect during and after the surgery. We'll be right back.
Tried all sorts of cover-ups for bad breath? Try the science of Breathorex. Only Breathorex has Zytex. It attacks the cause of bad breath, keeps working for hours. It's clinically proven for real fresh breath.
Get non-prescription Breathorex from your dental hygienist and now at fine stores everywhere.
You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, mommy makeovers. With us, we have Dr. Cohen, board-certified plastic surgeon. And so we're back. Tell us, now, mommy makeover, for people just tuning in.
Correct.
Who's an ideal candidate?
Well, mommy makeovers are for the people who have had pregnancies and are no longer happy with how they look. And despite their best efforts with diet and exercise, they can't get their breast or tummy looking the way it did before the kids. So they feel like it's time to take care of themselves now, and they want to look and feel their best. And so a mommy makeover for these patients includes some kind of breast surgery to make the breast look as nice as possible, whether that's an implant or a lift or a reduction, and then some type of a abdominal surgery, usually a full tummy tuck, sometimes a mini tummy tuck, combination of liposuction for many patients in the love handles or thighs or wherever really they need it.
As a recap, this before and after, very interesting.
Yeah. So, you saw the front view already. I really wanted to show you the side view because I think it's very important to see that tummy tuck doesn't just affect how you look from the front, but it also affects the bulginess of the abdomen. So as you can see in this photo over here, and I'll show you the after as well, this is a woman who, if she's wearing a tight little dress at a cocktail party, she's not going to feel comfortable before the surgery because she's going to have this, they a lot of times call it a pooch, or they sit down and have this extra skin bunching up, or it's not just in bathing suits, it's in their clothes, and a lot of these women will wear compression garments under their clothes to try to hide it, but it doesn't always work, or it really limits the type of clothes they can wear. So after the surgery, as you can see, there's no excess skin, there's no excess tissue. Now she can wear the tightest dress in the world and she'll look fantastic.
Now, there's a lot of women that probably want tummy tucks that don't do it. What's their biggest fear? The incisions?
Yeah, it's kind of a wide array. I mean, some patients are worried about anesthesia, just going under anesthesia. I always tell them that the risk of anesthesia is a lot lower than the risk of driving your car for a couple-hour road trip, statistically speaking. Some people are worried about the scars, and I always assure them the scars are generally kept low, and over time they get nicer and nicer. It's always a very big trade-off for the overall reshaping for the scars.
And these surgeries are done at your center.
Correct. So, when I started my practice, yeah, I mean, absolutely. When I started my practice, I knew from day one I wanted to have my own surgical center so that I could control everything that happens there, make sure it's as safe as possible, and done with the highest standards that fit my standards. So, so all of my surgeries have been done there. I've done, well over 1,200 surgeries, and a lot of those were combination surgeries, so literally thousands of different procedures at my operating room. I only use board certified MD anesthesiologists who are all screened by me as the best in their field. Okay. And basically, everything is done to maximize safety. And after surgery, we have a recovery center that's just across the literally about 30-second walk from my office, where patients can recover for a night or two, because I never want people to go home the day after the day of a tummy tuck, because I want to have nurses that can keep an eye on them. Good. Yeah, they'd be fine if they went home for the most part, but I like to have that extra level of safety, having nurses checking their vital signs, making sure they're comfortable, make sure everything is going along smoothly, and that way I can check the patients multiple times before they head home. Okay, now let's move to the breast, because one of the things you do, we can't show the breast photos, they're on your website, by the way. Right, yeah, there's no shortage. Very nice, by the way. There's no shortage of breast photos on my website, that's for sure. But the lifting, let's start there. I told you, I've talked to guys that said, Randy, I don't like doing some of these breast lifts. Very tricky, take a lot of time. And on the phone, you said, well, I like to do it. Yeah. And why is that? Because I think there's one of the most dramatic surgeries you can do is a breast lift surgery, when women have these breasts that have become deflated or loose skin, and they're hanging down on their abdomen, and they literally just can't do much with them. Even in a bra, it's hard to, sometimes they say the loose skin kind of spills over the edge of the bra or my bathing suit. So these surgeries can be very, very dramatic changes for patients. That they're usually completely thrilled with the results. It's a challenging surgery, and a lot of surgeons don't do it because they may be nervous about it, or they just don't have a lot of experience. But I've done so many hundreds of these surgeries, I've kind of seen every variation there, and I feel very comfortable doing one-stage augmentation breast lift. And your incision, you say you almost never use that anchor scar. For full lifts, a lot of surgeons will resort to what's called an anchor scar, where you have a scar that goes around the areola, a line that goes down the breast, and then another one that goes under the breast. And I find that the vast majority of my patients, the biggest scar I need to do is a lollipop, where you can avoid that big under the breast scar, which can cause some problems. In and around, the nipple area. Yeah. You said you really have a close attention to detail there. Elaborate on that. I mean, how is your technique a little bit different? What separates you, in your view? I would say that in general, I'm spending a lot of time making sure that everything looks as good as possible. So I'm doing all dissolving under the skin stitching. I'm doing multiple layers of stitching to make sure there's not a lot of tension on the skin, to keep the scars as thin and fine as possible. With the areola, I know some surgeons will go a little bit faster, and the shape may not be as maybe a little different size areolas, or a little bit irregular. And I'm basically, if things don't look as perfect as I can get at the end of the surgery, I'm making some more little refinements to the areola to make sure it's as round as possible, as even as possible, make sure they're the same size. Do patients ever say that they're surprised with the outcome, that it's better
than what they expected? Do you hear that?
I do hear that a lot, where patients say, oh, I was so worried, and really it looked even better than I was hoping for. My breasts never looked this good even before I had kids.
But there's a lot of women, though, that avoid the surgery. I have a friend of mine who's avoiding the surgery because of the incision.
Right.
What do you say to these kind of people?
You know, I always tell them that number one, shape is the most important thing. If you have a nice shaped breast, the scars are not going to be as big a deal as you think they are, because you're going to have a beautiful, perky, round, youthful looking breast. Number two, most of the time, people aren't seeing the scars because all the scars are designed to be hidden within a bikini pattern. So if you're wearing a small bikini, if you're wearing a bra, a dress, whatever, you're not going to see those scars, but you will see the improved shape of the breast. So they're going to look
fantastic in clothing,
absolutely,
in a bathing suit top and things like that.
Yeah, and my goal not only is to get them looking great in clothes, I want to get them looking as fantastic as possible in the nude as well.
Okay, now the other photos.
Yeah.
And these are dramatic.
Okay.
These are mommy makeover.
Yeah, these are some probably I would say another notch up in terms of how big a change this patient has undergone. So, you know, as you can see before, this patient has a tremendous amount of loose skin and excess tissues, and she almost has like multiple rolls of skin. She couldn't stand it. There was no way for her to hide that. And
how old is this person?
This patient's she's in her late 40s. Probably now might be in her early 50s. So, you know, as I said before, sometimes you have the stereotype of people getting mommy makeovers.
Looks like an old woman right there, by the way.
She looks like
late 40s. That's young.
Yeah, when you look at that body, you'd think she's a lot older than she is because of the loose skin, the wrinkles, and everything else like that, the droopy-looking belly button. I mean, this is a woman who just doesn't feel comfortable with her body in any circumstance. Certainly, she told me I wouldn't be caught dead in a bathing suit at the beach. I mean,
so they say that, okay.
Yeah, and then, but beyond that, she can't even find clothes that fit well just for regular daily activities. You know, not even talking about swimming.
Do they ever say, Doc? I mean, have you ever seen anything this bad in your life, or am I too far gone?
You know, sometimes they'll say, you know, they always say funny things like, oh my God, this is gonna be the worst you've ever seen, or don't let me break the camera, or whatever. I always tell patients, look, I guarantee you're not the worst that I've seen. I've seen such a huge range from fairly minor problems to extremely severe problems. But the bottom line is that everybody feels the same way. They're unhappy with things they can't fix by themselves, and whether it's a small problem or a big problem, it's still gonna have an impact on what they wear and what they do.
In your mind, when you look at this before,
yeah,
when you look at this woman, do you think, oh boy, this is gonna be good? I mean, do you see the end result?
I do, and you know, patients can see me smiling during the consultation, where they see how excited I am, because I'm looking at them and saying, in my mind, I'm thinking, wow, I can't believe how big an improvement I'm going to be able to get for you. And I'll tell them that. I'll say, you are going to be extremely dramatic change, and I can't tell you how excited you're going to be after surgery. And they can see the enthusiasm. I mean, they usually get kind of extra excited to do it themselves at that point.
Okay, so her after, let's take a look at that.
Yeah, so I mean, look at the difference. I mean, it's just incredible. So I literally got pounds of skin.
That's 25 years younger.
Yeah, I mean, easily. Like I said, she probably never looked that good, and that extra, it's a little hard to notice, but all that extra skin at the bottom is actually pubic skin that was hanging over her, you know.
So that's pubic skin right there.
Extra pubic skin, so I get to lift that for her and improve that whole area, as well as just the stomach area, the love handles. She doesn't have that muffin top anymore that women are always complaining about. You know, it just completely transforms how her body looks, and now she can wear the dresses and the clothes that she wants to. She doesn't have to worry about wearing compression garments, and she can go to the beach.
This is a huge change, by the way.
Huge change.
In a person's life.
Absolutely. Yeah, I mean, night and day. You know, every time I see her in the office, she has a big smile when she walks in, and just, you know,
How many years does somebody put up with something like that before they do something about it?
You know, I mean, in her case, decades. I mean, people, you know, some people know after they're done having kids, they're like, I'm going to the surgeon, getting this stuff fixed up because I hate how I look. And then other patients are very reluctant or very nervous, or just didn't think it was even an option for them. And they may live with it for years and years, and all of a sudden they see a friend, or they see a picture online or something, you know, similar to them that they saw the before and after, and they think to themselves, well, why can't I do this too? I want you to look at this side view of this woman, okay? Take a look at this before, and you see this tremendous amount of skin overhanging her waistline. And she also has another level of skin that's overhanging her belly button, and you can't see in this picture, but there's more skin overhanging the pubic area. And she just doesn't want to live like this anymore. Look in the after photo, you're seeing it's basically smooth from the ribcage all the way down.
Almost looks touched up on the side.
It does. It looks like you basically just took a knife and sliced everything off, but obviously it's much more complicated than that. But it's literally, like I said, pounds of skin and fat removed and retailored, not to mention the deeper layer of tightening, which we talked about earlier, the muscle tightening to flatten the abdominal wall so that everything takes on a nice hourglass figure and she looks feminine
What about a tough economy? You know, somebody says, you know, is this necessary in a tough economy?
Yeah, I mean, people always ask me, you know, is your business turned down with the economy getting so tight? And I've been amazed, but actually, it's if anything, I've gotten busier. And I think one of the things that people don't realize is that when you're out looking for jobs or in the workforce, if you you look and feel your best, you're going to project confidence, and people are going to be more likely to either hire you or promote you. And so these patients are seeing this as an investment in themselves to look as good and feel as good as possible in order to be as viable as they can in the job market.
If somebody's watching this, of course, they go to the website and see the more graphic or revealing photos.
Right.
But do you do the consults?
Yeah, absolutely. So when patients, one of the things that patients love about my practice is they see me every single time they come in. So they see me for the initial consultation, they see me for the day of surgery, they see me for the follow-up visits. So basically, I'm always available because for me, I feel like I'm going to do a better job of keeping an eye on patients and making sure things are coming along than anybody else out there.
Okay, good. You say you do almost everything. I mean, you don't like to use
It's a little bit
sometimes.
Yeah, I mean, it's a little bit of a bottleneck in my practice because there's only one of me to go around. My office manager.
You do it because you're a perfectionist, or you do it because
I do it because I feel like patients are putting their trust in me, and I need to give them as much of my time and attention as I can to make sure that their path from start to finish is as smooth as possible. Are you exhausted
when you get home?
That's a little bit tiring at the end of the day. I end up talking about a lot of things with a lot of different patients, but they appreciate it, and for me, my enthusiasm stays high because I'm excited about what I can do for these people, and when I see these follow-up patients, it's always a big, it's just a big. Exciting day to see all these excellent results.
This is how you get your kicks. I mean, you like the after. I mean, you like when they tell you.
I love to operate. I think operating itself is very enjoyable, and even more so, I like seeing the changes that I can create for people physically, but also emotionally and just in terms of their confidence when they come in the office.
Final message to somebody watching this: they don't like the way they're aging. They don't like their body. Maybe they lost 100 pounds.
Yeah.
What's your recommendation?
I mean, the bottom line is, if you're not happy with how you look, there are options, there are things that you can do, and that's what I'm here for. So basically, I invite patients to come into my office. I'm going to give you a personal evaluation, take a look at everything. We'll discuss what you want, what you don't want, what I can do for you, and just know that you don't have to live with a body that you're unhappy with. It's not for everybody, but if it's something that really bothers you, things can be improved dramatically, as you're able to see. And if you look at the hundreds of photos on my website, you'll see many examples of different patients, different ages, and you probably will be able to find somebody that looks like you, who you can see, well, what can I expect from a before and after standpoint.
Good. I want to thank you for coming on. Very interesting.
Pleasure
Good stuff. Good stuff. And we'll have you back on the show to talk about some of the other things you do in the future.
Appreciate it.
All right.
Thank you very
You've
much.
been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you can visit our website at wellnesshour.com. Just put in Dr. Cohen or put in Mommy Makeover. You'll find him there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.